KYRS is commercial-free, listener-supported community radio. Please support independent media by making a donation at kyrs.org or over the phone at 509-747-3012.
You're listening to KYRS Medical Lake Spokane. This is Free Range, a co-production of KYRS and Range Media. It's Aaron Head here. We don't got any other Rangers on the show today. It's going to be me. It's kind of a special show. I'm joined by Robert Sevilla, who hosts Creative Mindset after this show.
Hey, Aaron.
Every day. How you doing? And we've got a panel of experts, activists, and affected people by the healthcare landscape in Washington. And some of them are advocating for healthcare reforms under the umbrella of an organization called Whole Washington, which is basically an effort to establish single-payer healthcare in the state. We're going to continue this discussion on Creative Mindset starting at 4 p.m. today. In the studio, we've got Katie Purviance, thank you for the pronunciation, who's the founder of the Spokane Learning Co-op, who organized the panel today. And I think you've been on Creative Mindset before, right?
Yeah, I have. I've been on a couple times. It's great to be back.
Yeah. Thanks for joining us. We've also got Andre Stackhouse, who's going to be calling in. He ran for governor on the Green Party ticket last year, and he's with Whole Washington. We've also got Michael Doyle, who's also with Whole Washington. And then we've got several people here who have been impacted by the private healthcare marketplace. And I was hoping for the format of this show that I've never reported on healthcare before, so I was hoping that Katie could kind of run things and ask questions of the folks who showed up to tell us about this really important issue. And I know that Pia Hallenberg needs to go first because she's got to take off kind of before the show is over. But I was hoping before we get started, if we could just kind of try to set the table a little bit, and either Andre or Michael could give us sort of like an overview of exactly what Whole Washington is, what you're trying to establish, and what the stakes of this issue are. And I don't know if we've got Andre called in. Andre, is that you?
Yes, it is.
Thanks for calling in. We appreciate it. Yeah, can you tell us about Whole Washington and what's at stake in this issue?
Yes, thank you so much for having me on. I'm the executive director of Whole Washington, and Whole Washington is a 501c4 political nonprofit. It was founded around 2018 and ran its first ballot initiative in 2018. So we are the largest universal health care organization in Washington. We have the only universal health care bill in the legislature right now. And we're really the only organization that's actively building towards a ballot initiative campaign if we're unable to get the results that we want through our legislature. So our signature universal health care bill policy is called the Washington Health Trust. And effectively what it would do is expand the public insurance in Washington, which covers many people already, Medicaid. There's the public sector employee plans if you work for the state or you're an educator. Those are called PEB and SEB. And then, of course, there's the federal programs like Medicare. But our goal is to create public plans in Washington such that anyone would be eligible to enroll. So unlike right now where you have to be over 65 to be in Medicare or you have to be under a certain income threshold to be in Medicaid, we really want to create a reality in Washington where instead of having to get your health care through an employer or having to buy it on a private marketplace, that the state guarantees that you can enroll in a Washington state healthcare plan and that all of your medical needs would be paid for through that plan. So when you go to the doctor, when you go to the hospital, you're not really worried about how much is this going to cost? Am I going to get a surprise bill? The coverage of this plan would be comprehensive. So it's, universal eligibility, everyone can enroll in it, and then comprehensive in its coverage. So all of your medical needs are covered, and then free at the point of service. So you're not worried about going to see the doctor, and that way people can really take action early, address their medical needs before they become incredibly dire, and that way, in the end, we're actually going to save a lot of money through this system because it's so much simpler, it's so much more efficient, there's less waste, fraud, abuse, profiteering, and we can really get the insurance companies as this kind of middleman between patient and provider, and really just let these be decisions between the patient and their physician.
Okay, so it seems like it's just trying to make sure that everybody has access to healthcare that's transparent and simpler. It like streamlines all the bureaucracy that exists in healthcare companies. How long have you been advocating for this law?
So Whole Washington has existed since about 2018, which is when we ran our first ballot initiative, which unfortunately we didn't make the ballot, and it's a incredibly huge task to make a statewide ballot in Washington if you're grassroots. So if you have access to big money, it's relatively trivial to just pay for canvassers, pay for all the advertising you need, and get something on the ballot. And we certainly saw that in the last election with 4 ballot initiatives funded by Brian Haywood, who comes from the world of finance. But for a grassroots effort, when this is collected by volunteers, you're talking about collecting about 500,000 signatures on paper with ink in about 9 months. And so that is requires a lot of grassroots organizing. It requires a lot of volunteer effort. And so far, we haven't been successful at that. But I think it's important for people to recognize that the universal healthcare movement in Washington alone goes back at least to 1993. There was a bill called the Health Services Act that was passed, and then with the sort of Gingrich takeover of Congress federally, unfortunately, most of that bill was repealed before it was ever implemented in 1995. And there have been efforts from other groups between then and now. So there have been attempts at ballot initiatives before. There was passed legislation called the Washington Health Security Trust, and that's actually what we based our bill off of. So we didn't start from scratch. We took prior existing legislation and really developed it into something that was appropriate for the time that it was being introduced. And we were, we added a financing portion. We added some details to the transition plan. But the sort of current effort, especially that Whole Washington is involved with, began in about 2018.
Thank you so much for that, Andre. I really appreciate it, just like laying the issue out. But I think we've also, we've got some folks in the studio today that have been impacted by the private healthcare system. And I was hoping that Katie could lead a discussion with some of them, just to like let people know why this matters and the faces that this issue affects.
Yeah, thank you, Aaron. I'd like to introduce some of our guests here today, and I just wanted to take a moment to express why I got involved in Whole Washington. I'm an English as a second language teacher before I started the Spokane Learning Co-op, and I spent most of my career abroad. In other countries, it's very easy, very cheap, or free to see a doctor, and it's very high quality. And in other countries, I've experienced better health care than I've received here in the States for almost like a laughably low cost, if not outright free. And so coming back to this country after being abroad for so many years, it's been a real shock. Of course, before I left the country, I was, I had to face the healthcare system too. But after being in a variety of countries where it's just so easy, as soon as I heard about Whole Washington, I just knew I had to get involved. And I've been on KYRS a couple of times, and I know it's a great community resource, and I know people have found me because of our programs here. And so I had this idea that it'd be great to get some local people from Spokane on the air to share their stories and to hear how those things would have played out differently if we had the initiative that Whole Washington is proposing. And so we've got a few people here in the studio that we've had some Facebook conversations. I've been looking for people, and these people have courageously stepped forward, willing to share their stories. And I'm just so happy everyone's here, because I think this is something that can benefit everybody. We have so many different kinds of stories here, and there's so many more. I talk to people who, they're just overwhelmed. And they're hoping we can have a show like this again. They hope to be on a future show. We could do something like this again. So maybe this is our first one. But yeah, I have a list of people here who are in the studio. And yeah, maybe we can just maybe I could just call on people, share a story, and then either Andrea or Michael can step in and just walk us through it.
That sounds great.
So first up, I can't see you from where I'm sitting. Pia, I would like Pia to go first, if that's all right.
That's okay. So my name is Pia Hallenberg, and I'm here to share two stories. I actually grew up in Denmark, where and what you all call socialized medicine is common practice. We've always had full coverage of everything. So I know that system very well. But the story I want to share is about some years ago here in Spokane, I changed jobs. I have epilepsy, which is not a secret in the community. I'm very out about it because it's very well managed. But I take medication every day. So when I change jobs, one of the first things I ask about is whether there is healthcare coverage. And I was told that absolutely there was healthcare coverage. I had nothing to worry about. And I left one job, I took the new job, and I went to fill my prescription at the pharmacy. And the pharmacist looked at me and said, "Your insurance doesn't cover your seizure drugs. Why are you even here?" And I was like, wait, I need these drugs because my brain doesn't work correctly if I don't take these drugs. And then I can't work and I can't drive, and there's a lot of things I can't do. So what do you suggest I do? And they said, well, you can call this number and maybe you can get a coupon and you'll get like 10 tablets, this week and 10 tablets next week. And I said, no, I need to take this drug every day at a certain time. Otherwise it doesn't work. And they were just like, well, we're really sorry. So I called the insurance company and they basically said the same thing. They said, you're not covered. And I'm like, well, so what does a person do? And they said, well, you can always buy the drugs yourself. And I said, all right. Back to the pharmacist I went, and it turned out that my seizure drugs were $250 a month. So I paid that out of pocket for 2 years while I was appealing this decision through the insurance commissioner or whoever it was. And finally, after 2 years and a lot of stress, I was able to get coverage of that drug again. But it makes absolutely no sense to me that an insurance company can make that call. If I could go without the drugs, I surely would, but I can't. And so it was really a rude awakening. I never thought that was going to happen to me, but it did.
I think this is a really common problem with insurers. They'll deny needed care just for whatever reason, and like there's obviously a market incentive to do that. So you're in a landscape of like a large like you're not alone, I guess.
No, I know that, but it doesn't really. I mean, I'm very happy that I have the resources that I have, and I have the abilities that I have because I'm a well-supported person in so many ways. I'm not wealthy, but I'm well-supported, so I'm able to fight a battle like that. But there are lots of people who are not in that situation, and they would never have been able to make a phone call a week for a year and a half until you actually got some movement. And my employer at the time did not help me at all. It was up to me. If I wanted to change something, it was up to me. And so it's when you are somebody, and I mean, when you're someone who's already dealing with a medical issue, that's a lot to ask. And I'm, like I said, I'm relatively highly functioning the way things are, but there are lots of people who have epilepsy who would never be able to make those phone calls. It's just not an option. And it just, I guess it bothers me deeply that it's the insurance company that makes the decision and not your doctor.
Thank you so much for telling us about that. It's heartbreaking when you need medication and then somebody who's not a doctor, the insurance company, is making a medical decision. They're practicing medicine without a license.
Yeah.
Michael or Andre, walk us through what this situation could have been like for Pia under Whole Washington's initiative?
Sure, I'll start us off, and I'll just say that, I think that one of the first parts of this story that I think is worth focusing on is I already mentioned the profit-seeking middleman of the insurance company, but this also adds another one, which is your employer, right? And so the first part of this is that, it's a very unique feature of the United States healthcare system that most people can only get coverage through their employer, and that creates a relationship between a worker and their boss, where their boss can actually make decisions that have incredible impact on the person's just health and well-being. The second thing is, what does this do to labor, right? It makes it incredibly difficult to actually pursue the kind of life you're trying to pursue because the stakes are so high when your prescription drugs or your access to your doctor is tied up through your employer. And so workers often are trapped in a workplace situation that is not ideal. So by decoupling coverage from employer, what we do is we actually free up workers to pursue an education, change jobs if they are not happy in their current employment situation, or maybe start their own business. The cost of healthcare is an incredible cost on small businesses, and for that reason, many can't even afford to provide insurance to their workforce, even though they might really want to. And even, when we talk about labor issues like going on strike, and there are, we have this theoretical right to strike in the workplace, but there are ways in which an employer can cut off the access of striking workers from their health care, and that becomes a means of coercion to end the strike, accept terms that they don't wish to accept, and go back to work. So that's the first part, is just the way in which healthcare is tied to employment. And under the Washington Health Trust, that would not be the case. You would always be able to receive your coverage from the state rather than from your employer. In that way, that allows people to focus on their healthcare needs, and it allows the businesses to focus on their business. They should not be these two-bit insurance administrators. So the next part is just, I think it's people hear universal health care and they almost don't believe that it's true. So it should be said explicitly, prescription drugs are covered by the Washington Health Trust, and the only time in which you would be expected to pay anything, and it would be capped at $200 a year maximum, but that would only be for selecting a name brand drug when there is a generic available. So if you select a generic, or you select a name brand drug but there is no generic on the market, all of those costs would be covered. So there would be no $250 a month, and you wouldn't need to basically call your insurer and advocate that they give it to you. So I think that this is a great example. I mean, it's a great example of how horrible the healthcare system is, and thank you for bringing together all the people to tell their stories today, but it's not hard to find. I mean, everyone has stories like this, and under the Washington Health Trust, basically almost none of that story would have been applicable.
Thank you so much. It's really encouraging to hear that if we just had a different system, we wouldn't have to suffer the way that we do with these monthly costs and having to advocate for ourselves for the medications that we need just to live. Next, I'd like to have Courtney share her story.
Hi, everyone. I actually have a really long story, so I would like to offer the option for the others in the room, if they have shorter stories and perhaps need to leave, to go before me. No?
Would anyone like to volunteer?
No. Okay. All right. So my name is Courtney Anderson. I've been pretty active in the community as an advocate, basically, since I was old enough to do so. I was born with cancer, and so I was born in 93 here in Spokane with a cancer called neuroblastoma, which is a cancer of the nervous system. And they didn't find it. I wasn't diagnosed until February of 1995. And that is because my parents took me to the doctor month after month after month, and the doctors just found any other reason, right? They diagnosed me with asthma. They diagnosed me with, so many other things besides cancer, to the point that in 95, or February of 95, when they did diagnose me, I was stage 4. And so if the doctors had found it at any time prior that my parents took me to the doctor, it would have been in a different stage, right? And from February 95 to October of 95, I went through pretty much every single cancer treatment known to man at that time. In Spokane, here at Deaconess, actually, when they had the childhood cancer department. That's no longer at Deaconess, it's at Sacred Heart now. But I had the famous Dr. Reynolds. If you're in the community, pretty much everyone knows Dr. Reynolds. Anyway, so I went through chemotherapy and radiation. It was both full body, radiation and direct. I had surgery as well. There were 5 tumors in my body. There were 3 in my skull, 1 against my lung, so that's 4, so maybe 6 tumors actually. 2 in my abdomen. And so I had surgery for the ones in my abdomen. I had a couple direct radiation for the tumors that were in my skull. And then there was the one that was pressing against my lung on my back that they just couldn't get to. So essentially, I also had a full body blood transfusion as well as a bone marrow transplant. And for those 6 months, they did everything that they could, and it wasn't working. And in October of 95, they sent me over to Seattle to Swedish Hospital and Fred Hutch, and they basically said, prepare yourself to not bring your daughter home. They sent me over there for an experimental drug that had only been used in the South, actually, and I was the first person to use it up here in the Northwest. And that is a stem cell transplant in which they harvest your healthy cells, put you through immense treatment, and then they put the healthy cells back into your body to see if they'll start spreading and start attacking the chemo. Miraculously, because obviously I am here and you're listening to this, that did end up working, right? But imagine yourself as a parent with a child who had cancer, and what would you do? Like, you would do everything that you could to keep that child healthy, right? However, cancer treatments, especially in the 90s, especially for children, there weren't very many treatments that were made specifically for children. And so I was receiving treatments that were made for adults with cancer. On my tiny little body at 17 months old. And so unfortunately, unfortunately, I'm not really sure at this point, but it led to an entire lifetime of being in the hospital, of having to go through tests, of having to take medication in order for my body just to function, just to be alive. And recently, actually, I also spoke regarding gender-affirming care to our city council because I have to take gender-affirming care every single day just in order for my body to function, in order for me to be here. And we get so caught up on this term of what is gender-affirming care, right? I specifically started my discussion with the city council stating that literally everybody has gender-affirming care, right? Elon Musk, gender-affirming care. He had a hair transplant and he had jawline surgery. That is gender-affirming care, right? If a woman has ever had IVF or any type of medication in order to become pregnant, that is gender-affirming care, right? Because of my direct radiation, I had it directly to my pituitary gland, right, which is the hormone in the organ in your body that controls all of your hormones. And your hormones are there for many different reasons, right? So specifically, let's talk about estrogen. Estrogen is really good for bone density. It ensures that you don't break a bone or have brittle bones, right? It's one reason why doctors prescribe estrogen for those who are those who are postmenopause, right? So they don't just end up having brittle bones or broken bones. So I have to take that every single day. I also have to take levothyroxine every day because the organ doesn't work. And so I have to take synthetic medication in order for that organ to work, right? I also have to take progesterone so that, again, if we have enough education regarding the reproduction cycle of women, which, I mean, we don't, but estrogen, while it protects your bones, it also creates a lining in the uterus, right? And if that lining is not dispelled every month, then you get uterine cancer. And so in order to ensure that I don't get uterine cancer, I have to take progesterone every single day. So there's 3 drugs that I have to take for the remainder of my life based on, again, choices that I never had. These were choices that were decided by doctors when I was 17 months old, by my parents when I was 17 months old. And again, going back to a lot of what people have already talked about, healthcare being tied back to your job. Unfortunately, I am currently unemployed right now. I was on a contract and unfortunately was laid off. And so I am utilizing healthcare with the Affordable Care Act. Luckily in Washington, that is still available. And yes, that's also called Obamacare, Affordable Care Act. Those are the same things. And if it weren't for the fact that Washington State has extended those opportunities, I wouldn't have access to any of that medication, right? Well, additionally, about almost 10 years ago, so roughly 9.5 years ago, I was diagnosed with a second cancer. I was diagnosed with colon cancer, and that was a direct result of the radiation that I had when I was a child. And so because of that, I also had to have surgery. We caught it early enough that I only had to experience surgery. But again, going back to whether it's tied to employment and additionally, insurance companies, they can choose which labs, which doctors, which hospitals are within their network, right? And if you have your healthcare tied to an employer and you only have 1 or 2 options, like you may not have access to the doctor that you had access to months prior, right? There was an experience of mine in which I went and got a lab done. And the doctor decided to send it to a particular lab that my insurance did not cover. And so I ended up getting a bill for $10,000 because the doctor decided that, right? And then the insurance decided, oh, we don't actually cover that lab. So you're going to have to pay outright. And so I fought with the lab, and I fought with my insurance, and I fought with the doctors, and I just said, I don't have control over which lab. You have knowledge of all of these lists of labs that could potentially do the tests that you need that are in network with my insurance. Why did you choose that lab? And additionally, going back to your experience, Katie, and your experience, the previous person talking regarding healthcare outside of the United States, I spent 5 months in Morocco for a degree of mine. And in that time period, that was about 3 months before my diagnosis of colon cancer. And I had severe pain while I was in Morocco, and my advisor with the program took me to the hospital, got in right away, had my blood drawn right away, got an ultrasound right away, same day, within an hour. And you know how much that costs? Less than $100 for all of that. And that's in Morocco. Not to say that they have better or worse health care. It's just not necessarily a country that you think about when you think about universal health care. Additionally, you know, my dad, let me back up and say, in Washington State, it's thankfully you can be on your parents' insurance up until the age of 26. And so I was really thankful that I could be on my dad's insurance up until that time. However, he worked in hard labor, and that's the reason why I had such good health care. That was the reason why I was able to afford to pay for all of these experiences, is because he stayed in that job, even though it was backbreaking labor, and he resented the fact that he couldn't go get another job, knowing full well that I was going to lose my health care. He didn't resent me. I don't want anyone to think that, you know, that was felt in my way. But he resented the system. He resented his job that forced him to stay there. He resented the fact that really only these backbreaking jobs provide the level of health care that allowed me to get to that point in time, right? And additionally, you know, in the past 40 years, there's been a 35% increase of childhood leukemia. Cancer is the leading cause of childhood death by disease in the United States. And only 4% of all cancer funding goes towards childhood cancer. And that's decreased now because our current administration has decreased funding for cancer in all parts. And if cancer in all parts is being decreased, so is childhood cancer funding, right? So the experimentation, right, the funding that allowed me to get to this place to talk to you all about my experience, that is decreasing while the rates of childhood cancer are increasing, right? And so these are all reasons why we need to have universal health care. Because what would you do as a parent if your child was diagnosed with cancer? You would do everything.
Thank you so much for sharing all that, Courtney. Like, I can't even imagine what you've been through and what your parents have been through. This has been a very long journey. I took a couple of notes on a few things that stood out to me, and I was wondering if Andre or Michael could talk to us. There were a couple of things. One was your labs being sent to a lab that was not covered by your insurance. Like, you would think that, you know, the doctors have all this information, they can make a better choice, and they choose something that is very disadvantageous for you financially. So I want to hear about that, and I also want to hear if there's any part of the initiative that helps to fund cancer research, because as we all know, a lot of the funding that we need for such things is going away. So, and I myself don't know if that's part of the initiative or not, but that's something I would like to know. Michael or Andre, could you talk about those two things for us?
I'd love to let Michael go first because I feel like I've been talking so much.
Well, I'm not actually as knowledgeable about the campaign itself. I just joined because I think that universal healthcare is really necessary, and I believe that we need to build a grassroots team to get this initiative on the ballot. But I think Andre is the perfect person to answer any of these questions. And
Sure thing.
Sorry, go ahead.
So on the topic of the cancer research, I want to make a couple points. And the first is that in Washington, we have what's called a single subject requirement, which tends to mean that initiatives can't go too broad in what laws they change. And so in that sense, the initiative is primarily a universal healthcare financing bill. And so even on other questions, like does it build hospitals? No, it doesn't. What it does is it basically picks up the bill of the people of Washington and makes sure that the funding is available for their health care needs to be paid for. That said, I think it's very important for folks to know that an incredible amount of the research that is done to make these sorts of advancements comes from our public funding and done through our public universities. And so in many cases, we may be aware of some miracle drug with a brand name that comes from a well-known pharmaceutical company. But in many cases, the original research done for that is done through our public institutions. And it's only after these miracle discoveries have been made that it then gets passed into the private sector, where through the use of intellectual property laws, they're able to make these drugs proprietary for a number of years and rake in incredible profits. I mean, just look at the profits of the pharmaceutical industry sometime. It's one of the largest industries in the United States. I think at least a $600 billion industry. And a large part of what they do, is decide who gets it, right? And how much are you going to get charged for it? So I think that by removing a significant amount of the profit incentive from the healthcare industry, and there's a number of ways. One thing is the Washington Health Trust would allow the state to negotiate on pharmaceutical prices with pharmaceutical companies. So there are some mechanisms in which they'll be able to drive the costs down and get better prices. But I think that by removing a significant amount of the funding, the profits from the pharmaceutical industry, that money will be more available for original research. Can you remind me what the other part of the question was?
Yeah, there was an issue about according to your doctor, had your labs go to a lab that was not covered, and she was stuck with a $10,000 bill for that. And us as mere mortals, we don't necessarily know which labs are covered and which are not. But somebody who is in that position, the doctor themselves, like that's just a situation that should not have happened. Can you talk to us about, I know just everything is covered, but what would it be like when, could something like this happen under Whole Washington's initiative, where all of a sudden you get a $10,000 bill because of the lab your doctor decided to send your specimens to?
Mm-hmm. So I think what this comes down to, right, is again, because of the complexity of the system and with the insurance companies playing such a large role, they create these networks. And through these networks, they are able to say, this hospital is covered, this procedure is covered. It removes a huge amount of the transparency, right? Now, in this specific case, I think, I can't speak to what led the doctor or the hospital to make the decision the way they did, but what I can say is it's complex for the providers too. And a significant amount of the budget for doctors and hospitals, and we're not just talking money, we're talking time, is going towards interfacing with these insurance companies, right? And so a lot of the times, first of all, I think anyone who's ever asked their doctor, say, how much is this going to cost, right? They're very accustomed to hearing the answer, I don't know. You'll have to talk with the front desk. You'll have to talk with your insurer. So a lot of the times doctors just say, don't even have any idea how much this is going to cost the patient. If they do have an idea, they may often be incentivized to change their medical recommendation because they're aware that the patient can't afford it, which is just an awful position for a physician to be in. But we have these insane situations, right, where you may go to a hospital that is in your insurance network, and then the MRI machine or the specific doctor that you receive care from is not in network. And this is just, nearly impossible to navigate as a patient. And so the Washington Health Trust, I think one of the most important things it does is it creates a universal network as well. And so part of what happens is that there will never be an insurer saying no to a doctor or a hospital, and all providers will be eligible to participate in this program. I think that the incentive on the state is going to be, right, so it will not be required of all doctors and hospitals to participate. That will be, to some extent, voluntary. And there's a lot of nuance about the transition plan. Not all of this happens on day one, but the state is still going to be the one who bottom lines your medical costs. And so if there's a situation where it goes to the wrong provider and then that drives up the cost significantly, that's going to cost the state. And so the state will have a very strong incentive to make sure those details are done correctly, because it's going to save them money in the end. Whereas in the current model, a lot of the times that sort of situation actually ends up driving up the profits of the medical industrial complex, if you will, because basically higher prices usually are higher profits for someone in the system, even if they're kind of passing around who's getting it.
Thank you so much. Thank you for walking us through that and explaining it. We have an interesting thing here. We actually only have one line to call in, and we have a provider who had a few minutes between patients to call in. So, Andre, if you don't mind, I'm going to very politely ask you to hang up, and then that will allow our provider to call in just a couple of minutes. And we do have just a couple of minutes before this provider calls in. So I wonder if any of our KYRS hosts have a thought while this is happening, while we're waiting for our provider to call in.
I wanted to note something that really struck me in Courtney's story, just about like the complexity of the situation. And it's not just like the fact that healthcare is immensely expensive. It's that there's a lot of stigma laid on top of it. Courtney, you talked about gender affirming care, and there's I think the public has a pretty narrow view of what that is, but you laid it out really richly in the vastness of it and the complexity of it, and the idea that we all have gender affirming care. So not only are you dealing with an impossible bureaucracy, you're also dealing with social stigma that is really trenchant in our society. And I just wanted to dwell on that for a moment, because I think that's important to note. And I don't know if anybody else has anything else to say about that, but that's one thing that really struck me.
Yeah, thank you for that. I appreciate the ability to talk about it, because I think it's such an important issue that people don't necessarily realize that when we are so focused on one particular definition, it harms the majority.
I'm sorry, we're cutting you a little bit short because we have a caller on that only has a little bit of time.
And this caller is a healthcare provider who wants to remain anonymous because of the professional risk associated with just talking publicly about this issue. But caller, thank you for calling in. We really appreciate it. Katie, I don't know if you want to ask direct questions or if they have something to say off the bat.
Yeah, I thank you for calling in. Thank you for making the time. I wonder if you could just share with us briefly, what your experience has been like as a provider having to deal with health insurance companies.
Yeah. Hi, everyone. Thanks so much for having me on. Sorry I'm having to call in just in between clients. I'm not sure what's been discussed already, so I'm coming in a little bit blind. I'm a mental health provider in Washington State, and working with insurance is, for many mental health providers, a huge part of our job and something that is a constant source of difficulty. I thought a lot about what I wanted to say in this conversation today, and while I could go on and on about the challenges of working with insurance companies from the provider perspective, I think the biggest thing for this audience is probably how hard it is to find mental health care, a good mental health provider that takes your insurance. This is probably the hardest thing for folks who are trying to find a good psychotherapist to work with. Katie, does that sound like a reasonable thing for us to use our time to focus on?
I think that's fantastic. I've talked to a number of people here in Spokane where they just cannot find a therapist, a mental health professional who will take Medicaid or who will take anything other than private insurance, and they still have quite a large copay or deductible, and it just puts this type of very necessary help out of reach for a lot of people.
And it's, I think we're becoming more and more aware, especially with a lot of the discussion around mental health during the pandemic, that in many ways mental health is the foundation of our physical health. And mental health providers certainly know this inside and out. We know that the work that we do contributes enormously to our physical well-being. But the barriers to getting good mental health, I don't know whether they're in place by insurance companies intentionally, but they're certainly numerous. So in order to take insurance, a mental health provider in private practice has to ask the insurance company to be in network, and that's the first barrier. So it's not uncommon for insurance companies to essentially say, we have enough providers, we don't need any more, check back with us in a year. If they say, yeah, go ahead, you can join our panel and we'll take you on, we need more providers, the process of getting paneled can take months, it can take a year. It entirely depends on the insurance panel that you're working with. Once you're paneled, then in order to get reimbursed or paid by the insurance company, they set the rate, so the provider doesn't get to decide how much they're reimbursed for a session. The insurance company does. And then they decide they're contracted to pay you within a certain time frame, but oftentimes that doesn't actually happen. And for this and many other reasons, more and more mental health providers are choosing not to take insurance. And what's happening is insurance companies are legally obligated to have a certain number of in-network providers, but they are creating something called ghost networks, which is essentially to say, we have all these providers, look at all these providers we have in an area, but when people try to call those providers, they call provider after provider and discover, nope, I don't take this insurance. Nope, I'm actually out of network. Nope, I'm full. I can't get you in for 6 months or next year. So there's this bottleneck that happens that insurance companies are not incentivized to solve, because mental health therapy, from their perspective, is just an expense. It's not something where they really see and prioritize the value to their insured person in order to have access in a way that the client says, this is what I need, and the mental health provider agrees, yep, this is what you need, this is the treatment plan. Am I saying that clearly?
Yeah, I had a question for you. You mentioned that it can take a while for providers to get reimbursed. In your experience, what are we looking at here? Are we talking about it takes a few weeks, it takes a few months? Like, what's your experience been like?
Yeah, most insurance companies are contractually obligated to pay providers within a certain time frame. Usually it's within 30 days. But many insurance providers don't have enough oversight to really ensure that this happens. And it's a huge amount of time and effort that mental health providers put into getting paid by insurance companies. So like I myself am still trying to get paid for sessions that were done in 2023. This is just an example. So more than 2 years ago. The flip side of that is that at any point in time, an insurance company can say, they can do something called a clawback, which is where they say, we paid you by mistake. We don't actually think this person was covered for this session. And so now we're going to withdraw the amount of that session from your next check. And even if they're making an error in that auditing process, you as the provider end up putting, many hours into calling them and trying to get it right. So there's this huge expense in time, and then there's this huge expense in money that goes into taking insurance.
Oh my gosh, that is just unbelievable. Let me ask you, in your experience, or maybe other providers, like how much of your work week or work month would you say you're spending just fighting with insurance companies, just trying to get paid or trying to advocate for yourself if there's a clawback situation? Like how much of your job is dealing with for-profit health insurance corporations?
I would estimate that if a mental health provider takes the majority of major insurance plans in their area and doesn't have the added expense of having a medical biller, so they don't outsource it, I would estimate that it's more than half of your week.
Oh my gosh. So when a person's calling around to try to get in for therapy and they're being told like there's just no openings, a big part of that reason is because you're just too busy trying to get paid for the people you're already seeing. Is that right? Would you say that?
Yeah, I think that that's certainly a big piece of it. I think another big piece of it is that insurance companies, there really isn't enough oversight for insurance companies to really ensure that they have enough providers for the area so they can open and close the door for new providers sort of at will. And then I think another sort of barrier, there's one insurance company that, depending on your plan, sometimes you have to ask the insurance company for permission to see the provider that you want to go see. So you could do something called an authorization, and then it's just another barrier to just being able to call someone up and say, hey, I need help. I'm not okay. I need to come in and talk with someone. So, this actually is happening for a client that I'm working with right now. I have a client who called me up last week. They're really having a hard time. This is somebody that I've worked with before, and sometimes their insurance says they can work with them, and sometimes their insurance says they can't. And they have, 3 or 4 different tiers of oversight in between the client just being able to schedule a session with me. So I have to fill out a form, then they deny that form, so then I fill out another form, then they deny that form, then the client fills out a form, and then they deny that form, so then I write a letter. And if the letter doesn't if the letter gets accepted, then I fill out the form again, and then they maybe accept it. Maybe they don't accept it. If they don't accept it, then the client has to go to their doctor and talk to their doctor about why they have to see me. So I've had clients with this insurance plan say that the aggravation of just getting in to see me is so upsetting that it aggravates their symptoms above and beyond the work that we were doing prior to having to go through this process. So it's not just that it's frustrating, but it actually creates a setback in their mental health, if that makes sense.
You really made that clear. You really spelled that out for us. I think we have to let you go in a few seconds for station
Yes,
identification.
I've got about
Is that-
1 minute left.
Yeah. Thank you so much for sharing all that. Right after we come back on, we'll get Andre back on the line from Whole Washington to, talk about what it would be like from the provider point of view. And thank you so much. I think a lot of us, as mortals, we don't really understand what it's like on the provider point of view. But thank you for spelling out for us that it's just as difficult on your end as well. Thank you so much for your time.
What I'd like to say to that, Katie, like this is sort of the end all be all of what I'd like to say is that mental health providers, psychotherapists, we want to be accessible. We want to be available. We want people to be able to call us up when they need help. We want it to be easy to call us up. We want to, be accessible and not have all these barriers. And there's a lot of conversation within the community around how to do good work and, make it so that people can find us and access us, but also live a professional life that focuses us on the work and not on all of these administrative mountains that we have to climb to take insurance.
Thank you so much. Thank you for your time. I appreciate it so much. Thank you.
Thanks, Katie. Okay. Bye.
All right. Andre, would you like to call back in? We'd love to hear your point of view.
Well, Andre's calling in. I just wanted to, I wanted to weigh in. Like that's, I've never thought about it from the provider's perspective, and I've sought mental health care before, and there's been a lag, and now I kind of see the other side of it, and how it's kind of, a lot of their time is just taken up dealing with the bureaucracy of the private healthcare industry, and that's really interesting. I think Andre's calling in a second. He's on. Andre, you there?
Yes, I am.
I'd love to hear, I know you were listening in while we had our provider on. I'd love to hear how Whole Washington's initiative would benefit providers. It's a point of view that most of us are not familiar with. And we were able to hear just how much of a struggle it is for our mental health professionals and other providers. How much, she was saying about 50% of the work week is spent just trying to get paid, just dealing with the for-profit corporations. What would that look like under Whole Washington's initiative?
Well, I think it would be dramatically simplified, and part of what we do is we create a much more uniform billing system, and so basically the same service gets billed the same amount for every provider and every patient. And so instead of having this incredibly convoluted, Rube Goldberg machine of who's paying what, the insurer is going to pay this much, the provider is going to pay this much, we're going to have to chase the patient down to pay some amount. Effectively, it turns it into the bill always goes to the same place, that's the state. It's always for the same amount. And so that allows for the provider to spend way, way, way less time on administration. And it doesn't really create the same level of overhead even for the insurer, right? In this case, the state's the insurer. But, when those things reach the insurance company, the first problem is they have an incredible incentive to take their time to make quote-unquote mistakes on the price. Oops, we overcharged you, right? Or we over-reimbursed you, and now we're trying to get money back from you. But when you really make it so that it's incredibly simple, and you can see this already. We have points of comparison, right? So administration accounts for about 17 cents on the dollar when you're going through employer-based healthcare, and it's about 2 cents on the dollar when you're talking about Medicare, right? And so when you really say everyone's eligible, everything's covered, and the reimbursement rate is uniform, you reduce the need for administration by a significant amount. And I may get this statistic just slightly wrong, but we do have a few studies that have looked into this, and the estimate is that and this would be probably an average across providers, because I think the smaller providers have an even more difficult time. When you're a large hospital, you may have some staff available to do this stuff, but I think it was something like an additional 6 hours a week available to physicians when working through this system. That's, forget about the admin department and the billing department. We're talking about the physician themselves dealing. Okay, maybe we do have, inadequate hospital coverage and we don't have enough doctors, but even just at the current medical supply, by reducing that complexity, you increase the amount of time and money available to provide actual health care to people.
It's astonishing. It's astonishing how much time our providers are forced to waste. Thank you. And I think we're going into station identification. Take it away.
Yeah, thanks so much for that, Andre. We are at the top of the hour. That means we're rolling over to Robert's show, Creative Mindset. We need to do our station ID. You're listening to KYRS Medical Lake Spokane on 88.1 and 92.3 FM. And we can keep going with the conversation. Essentially, it's still the same show.
Okay, great. Andre, do you have anything else you would like to share about what our provider told us, or are you ready for our next guest?
Let's keep it moving. We'll go to the next guest.
All right. Next up, we have Val. Val, welcome to the show.
Thank you. I'm glad to be here.
So would you go ahead? I know you had a few stories. Which one feels most pressing to you right now that you'd like to share?
Well, I do have several stories, and I'll try to keep it long story short, but I've had a lot of experience with Medicaid. I helped both my parents spend down their entire resources so that they could go on Medicaid and get the care that they needed. And that was a long and arduous and painful process, and I have a lot to say about that. But what happened for me in 2011 is that I got bit by a rattlesnake here in Eastern Washington, and it was kind of a big deal. I didn't know I got bit until shortly after it happened, and the feeling that I had was not related to the fact that I just got bit by a rattlesnake. It was that I was 36 hours away from being insured. Like I had switched situations and my insurance was going to kick in 36 hours. And so what I was present to was, oh my God, I can't afford this. That was my first question when I got in the ambulance and they took me to the hospital in Wenatchee. And it's what I was tense about in the emergency room when they were shooting me up with drugs and trying to get me stabilized and all that stuff. And I finally gave up when I just had to use the bathroom and I wanted to stand up to do so. And when I did, the pain was so intense at that moment, I just had to give myself over to the process. I'm obviously out of my league. I have to be here. Well, I was in the hospital for several days, and between the two emergency rooms I was in and whatnot, plus a spine issue that required surgery. So in that year, I got $155,000 worth of bills that forced me into bankruptcy, and then after that, I went into foreclosure. So I feel I'm very biased, because it's like, I feel like when a major situation happens, the first thing that should not be in your head is, can I afford to handle this issue? It should be, I have an issue, now what can I do to get it handled? Does that make sense? So I've got a lot of passion for that. So I learned from that, and then moved here to Eastern Washington. And briefly, my partner and I got on Medicaid. And I would just like to point out that I'm a productive member of society. It's not that I'm sitting around twiddling my thumbs. Like, I ran a newspaper for 10 years. I'm getting into real estate. I do workshops and seminars. I try to help out where I can. and I need Medicaid. So Medicaid has helped me a lot with my mental health. I was taking drugs that cost several $1,000s a month for that. Separately, my husband had advanced degenerative disc disease, and he had a large schwannoma tumor in his spine. So it took 3 major surgeries to get that handled. He lives in nightmare levels of pain to this day. So on the one hand, Medicaid paid for all those surgeries and we never saw a bill of any kind ever. And B, what kind of life would he have if he did not have Medicaid to pay for the medications that help him with pain control now? So in that sense, Medicaid, Apple Health, has been a huge blessing. And where I'm at now is I just got diagnosed recently with prostate cancer. So as I sit here, right now, I have prostate cancer. And it could be worse, but it needs treated, and I can't avoid treatment. And I'm not anxious in this moment about having prostate cancer. I'm anxious about what the government is doing that is potentially going to take away the care that I need, both to get it treated and the aftercare I'm going to need after it's treated. So along with that, if the government takes away Medicaid, which last night they sure took a major stride towards that, my mom, who has dementia, living in assisted living, will have to come live with me, and I'm going to have to take care of this woman that needs 24/7 care while I'm slowly dying of prostate cancer without medication. So I don't mean to catastrophize, but that's what's in my head. Like, how am I going to handle it if those services go away? And, I'm biased. Like, universal health care, I feel, should just be obvious. Like, I don't even understand. I can't wrap my head around why we're even having a debate about it. Why does not everybody just automatically get health care? So on the surface, not on the surface, but on one level, I am absolutely grateful that we had health insurance through Apple Health / Medicaid when we had it. And the first thing on my mind this morning, I woke up into anxiety because I'm terrified they're going to take it away.
What I hear is like you have this really complex history with your health. One stemming from a rattlesnake bite, or one that's part of what drove you to bankruptcy.
Yeah,
you're not worried about the diseases. You're worried about the bureaucracy and the money.
Yeah, I have treatable prostate cancer if I have insurance.
Yeah.
Val, thank you for walking us through that. You had a number of different things that any one of those things by themselves would be so scary and so awful and horrendous. And the fact that you even had to worry about the money part of it just turns each one of those into a nightmare. Andre, I wonder if you can tell us more about I'm thinking about medical bankruptcy. I'm thinking about foreclosure, like these huge medical expenses that lead to these life-changing, nightmare-level financial situations. What would, just to take that snake bite, and I want to come back and ask about some of the other things too, but just looking at that snake bite and the spine surgery that led to $150,000 out of pocket in 1 year that led to a bankruptcy and foreclosure. Could you talk us through what that could have been like under Whole Washington's initiative?
Yeah, I think there's a few different angles for it to come by, and I think that I think where I want to start is that we have such a fragmented system, and people do not live with what we might refer to as healthcare security. And so there are all of these different times in our lives where we may be covered, may not be covered, or certain things that we need are covered, certain things are not covered. And I think one of the most profound differences under universal health care is the concept that you will have, womb-to-tomb health care. And it begins at the recognition that none of us escaped from this, right? We are born screaming in a hospital, most of us, most of the time. And so we are born into this healthcare system. And then if we're lucky, we get a good number of years in the middle where maybe we don't interact with it that much. But in the end, we all end up with healthcare needs, and we reach the end of our time here on this planet, and we become, again, consumed by the healthcare system. And so it is so tempting, I think, for people to adopt a mindset of, well, I'm okay. I'm healthy right now. I'm working right now, so I get healthcare from my employer. And to take a very, very narrow viewpoint on it, in which they say, well, what do I need to care about my, anyone else? But the reality is, we all are in this system together, whether or not we want to acknowledge it. And so, if Medicare gets cut, right, you might say, well, I'm 34, right? So I may not be directly having my Medicare cut. I won't be eligible for Medicare for some time. But my parents have just reached the age where they are on Medicare, right? And so I can either live in a world in which Medicare is covering the healthcare needs of my parents, or I can live in a world where when they get sick, I have to worry about them. Who's going to pay for this, right? How is this going to work out for our family, right? The fact that healthcare does not acknowledge the autonomy of an individual, right? We've all just lived through a pandemic, right? Well, it turns out that when people are sick and they are suffering, that's going to create lines of hospitals. It's going to raise the cost for all of us, right? There are so many different ways in which issues intersect with healthcare. I mean, I think another one that gets talked about a lot of people know that we have a major housing crisis in Washington, and especially where I'm from, Seattle. But the reality is that when you have these insane healthcare bills that you can't afford, right, that contributes to your ability to keep a roof over your head. But when you are housing insecure, it is much harder to take care of your health. It's much harder to maintain your employment. So if you, for instance, you have to move because you can no longer afford the rent, and so you lose your job because you can no longer make that commute. Now you lose your insurance, so you can't see your doctor anymore. And so now your health conditions are getting worse and more expensive. This is how people end up homeless. And this is how people reach some of the lowest lows they may face in their life. And so I think that we need to recognize that this is not something that we can isolate ourselves from, or even isolate this issue from so many other issues that we're facing in the state of Washington. And there are I'm not going to say the number because I can't remember right now, but there are a non-trivial number of medical bankruptcies, and I can say this confidently. Both at the federal level and in Washington, medical bills are the number one contributor to bankruptcy. And so this is a major source of poverty in our state and in the country.
Thank you so much for explaining that. I've often heard it said that medical bills are the number one cause of medical bankruptcy and homelessness that cause and effect. And I think you illustrated it in a more profound way than I think many people usually think about it. Val brought something up that I think is on a lot of people's minds with everything that's going on in this administration right now, with his parents who are in assisted living who might not be able to what what would assisted living situations look like under Whole Washington's initiative for universal health care?
Mm-hmm. So long-term care is part of the essential benefits package. And so it is one of the parts of the plan that comes a little bit later in the transition. And there's a number of reasons for that. One, it is quite expensive. And so it takes time for the trust to build up its savings so that can be phased in. The other is that Washington has a long-term care tax. And so it is going to take some time to align what exists with what we conceive of under universal health care. But fundamentally, long-term care, which does not just, assisted living is not just for the elderly. It also covers many people who, in one way or another, fall into the disability community. In many cases, this may be veterans. But yeah, fundamentally, assisted living is healthcare, and so therefore it is covered under universal healthcare.
That's fantastic news, and I think that's a huge relief to a lot of people who they're kind of that sandwich generation where they're taking care of kids and taking care of parents who are getting older, or anybody who has a member of the family or a friend who needs some help and can't live independently. This really affects a lot of people, and so it's really reassuring to know that Whole Washington's initiative takes that into account and has a plan to make sure that everyone in our state is covered. I have another guest here who I am very excited to hear from. Jenny, are you ready to share your story?
Yeah, I think so. I'm a little nervous, but I'll just dive right in. I'm really interested in this issue because I come at it from a different point of view. I've been self-employed. I'm now retired since 1995. My husband was also self-employed starting in 2005. So we have been buying self-insuring since before the advent of the Affordable Care Act. And we were real excited when that came on board. But where we were at financially, we have only the 2 COVID years did we ever get a subsidy. So we have been paying full meal deal off of the exchange since 2008 and prior to before that. And, I was really excited about it because I love the concept of universal health care. And my friends are like, oh, I can get health insurance for $56 a month. And it's just like, well, that's not what I'm paying, but I'm really happy to be helping out society and that's supporting this concept. And what's kept me interested is that I've seen the numbers on what the taxpayer contribution would be to keep universal health care afloat versus what we have been paying just as a couple over the last few years. We've bought off of the exchange. We have never had a subsidy except for COVID. We did the numbers on the bronze plans with the HSA and with just multiple health things coming. We didn't choose the cheapest plans because what I see is with the cheapest plans, you've got just ridiculous out-of-pocket expenses and $12,000 deductibles, and it's not realistic for some of the things you're just talking about with in the prior topic of what keeps people out of bankruptcy, and we've been able to take, because of the way our businesses are set up, we could take the premium as a deduction, but that doesn't take away the fact that we're paying for it. And just to throw some numbers out here so people that get employer health care understand, our premium 2 years ago, 2021 was $13,000 for the two of us every month. My husband is now on Medicare, thank God. But what they don't tell you, and I found this out the hard way, is they're basing our premium through the exchange on our income, right? So my husband goes on Medicare, and what happens is my premium doubles because now my premium is based on the income that was like 50-50 beforehand. And so my premium is almost $1,600 a month. And that's not counting deductibles, co-pays, out of pocket, all this other stuff. And so like on the average in the last 10, 12 years, we've paid $27,000 just for the basics, premiums, copays, deductibles. And that's not even hitting our out-of-pocket maximum. So I'm interested in this because maybe, with Medicare approaching for me the end of this year, it's kind of a moot point and things will change. But I like the big picture view of, just like do people realize that their taxes would be, Andre, is that your expert here? He can kind of clarify that. People don't realize that it's going to cost them so much less to have universal health care. I mean, I'm really grateful we can afford it, but I also feel like we're the unseen people, the people that are just paying and paying and paying and paying. We can do it, but we're not happy about it. And someone's will be like, oh, we pay $300 a month for our family. And it's like, well, I'm really happy for you, but that's not what we're paying. We're basically getting screwed if you're self-employed and not buying through a group and not buying through an employer or some of the other options there. So that's kind of like the short version. And, if they want to ask me questions or something like that. But this is why I'm really interested in it, because I think we can do much better as a society.
Thank you so much for sharing that. Jenny does bring, Andre, Jenny brings a different point of view to this. We've talked about how people who are getting their insurance through their employer are kind of trapped, and, medical decisions in effect are being made by an employer, and it also limits them in, taking certain actions they might otherwise take in labor movement type of organizations. Because they're afraid of losing their job and therefore their health insurance. And Jenny brought up an interesting point that we haven't talked about yet, is what about the self-employed who are paying so much every month for their premiums, let alone deductibles and copays? What would whole Washington's initiative for universal health care look like for self-employed people? And I was wondering if you could also touch on, she mentioned how much we might pay in taxes to pay for this, for universal health care. I wonder if you could talk about both of those things, Andre.
Mm-hmm. So I think there's a few points that come up in this, which is the phenomenon of brackets and cliffs, right? And so many people may be aware of what's sometimes called the Medicaid gap, right? Where, especially in Washington, where we have a pretty good Medicaid program, you can get pretty good health care if you're below 200% of the federal poverty line, which is really quite low. I do want to actually, I should have earlier given a shout out to, I believe Val it was, for talking about his time on Medicaid, and Medicaid has covered me at points in my life as well. So we're quite fortunate to have it, but I think that people who exist in this world, especially of freelance contractors, sole proprietorship, self-employed entrepreneurs, and small businesses, they can be in this situation where they have Medicaid and they are pretty content with it, and then suddenly have to face the dilemma of, if I make more money, I'm actually going to lose my health care if I make more money. And that creates an incentive to not work or to keep wages lower, right? And it creates a political challenge as well, because the people who are just above that threshold are often the ones who are paying the worst. $13,000 a month is incredibly high when you're in that zone where you make too much for Medicaid, but you're not necessarily able to get, a nice insurance package from a large employer. And so the people who exist in this zone often can feel some amount of discontent looking at people who make less than them. They're getting better health care, and they go, well, why are they the ones getting the lucky break? Which, I'm being facetious. I don't think we should think of people in either of those positions as lucky. But the point here is you're separating haves from have-nots, right? And it's harder to create a system that can maintain a a certain level of political support. And so one of the ideas of universal health care is that we are all going to benefit from it. And in fact, it will be more resistant to political turmoil because a cut to the program is a cut to everyone's health care, and everyone is going to have an opinion about that. And so it's harder to say, well, they're just cutting somebody else's health care, right? So I think that's part of it. And effectively, by creating that single program, right, we get rid of many of those brackets and cliffs in which, you might have a situation. I've literally heard of people who choose to get married or choose to get divorced or report their taxes one way or another because of the amount that it impacts the how much they pay for health care. You did also ask about the level of taxation. So, I think that sometimes people like to make the point that, nothing's free, right? Just because you don't get charged when you're at the doctor or hospital doesn't mean it's free. And I want to acknowledge that. I think it's the same way where when, say, the fire department goes and puts out a fire on your house, they don't hand you a bill afterwards, and we know it's not because fire departments don't cost any money and firefighters are just these awesome people that work for free. It's only that it's already been paid for, right? And so that's what we aim to make healthcare work like as well. And so in that sense, the entire plan is funded through public financing. And really, the money comes from the same place that it comes from now. So right now, we pay about twice as much as comparable countries with universal healthcare systems. And in those countries and in this country, it effectively comes down to a split between employers and employees. In a universal healthcare system, it's usually paid for through some form of payroll tax or income tax. And then under our system, you pay a premium, but your employer probably also pays a premium. And in fact, that can lead to many of the misconceptions about how expensive healthcare is. I hear people say things like, well, I don't pay anything for my healthcare. My employer gives it to me. Well, unfortunately, that's not probably the case. Employers don't tend to just give expensive services to their employees. It's part of an employment package, and it's coming out of your paycheck. So your employer is paying a premium out of your paycheck, and then you're paying a premium also out of your paycheck. Under the Washington Health Trust, there would be an employer assessment, and that is graduated based on the size of the employer. So for the largest employers, paying what we would call the standard assessment is the 10.5% of payroll, which you can break down per employee. So it roughly translates to the employee's income. For a mini business, which I believe is revenues under $3 million, it would be 6.5%, and then for micro businesses, 4.5%. All of those employer taxes, up to 2%, may be deducted from the employee payroll. Now, that's something that the employer may choose to cover as an employment benefit, or they may choose to share up to 2% of that, any or all of that 2% with the employee. But for many people and many employers, this is very competitive with what they pay in insurance premiums right now. And it's not at all uncommon for employers to pay 12%, 14% or more. It actually, one thing it does is it inverts the way that this works right now. So right now, the employers who are paying significantly less than that are the largest employers with the highest income employees, may be paying a smaller percentage in premiums. But those are exactly the people and employers who would be least economically impacted by paying more into the healthcare system. So right now, you really have the poorest people and the smallest employers paying the highest percentage of their revenues into the healthcare system, with the largest ones paying the least. And so we simply invert that and set the highest level at 10.5% and the lowest at 4.5%.
So let me make sure I understand. So under Whole Washington's initiative for universal health care for all Washington state residents, it would mean no deductibles, no co-pays, and then the amount that's withheld from our paychecks and the amount that employers are responsible for, that amount also goes down. Is that correct? Is that how it is?
Of course, it will depend on exactly how much you make and exactly who you work for, but we can say quite confidently that for the majority of Washingtonians, this will be a significant net savings. And you know, part of what we are able to do with this, it was pointed out earlier in this show, that we already pay more than enough for a top-of-the-line healthcare system, because we pay more than twice as much as any other high-income nation for, you know, what they pay for a universal system. So there is a reallocation from private spending into public spending, but for and we have a couple studies that I can kind of point people to. In fact, if you go to wholewashington.org/studies, you can read them yourselves and see what we base this on. But the Healthcare Authority of Washington, which, if you're familiar with Washington Health Plan Finder, the Healthcare Authority runs that site and gets millions of people signed up for healthcare every year. But they ran a study, and their findings were that in an implementation year, which is the most expensive year to implement universal health care, the state could expect to save between $800 million and $2.5 billion in an implementation year. On an annual basis, post-transition, it would be $5.6 billion. We've worked with an economist named Dr. Gerald Friedman out of UMass Amherst, who finds that the savings could be as high as $13 billion in total healthcare spending. So some of this is shifting from private to public, but the total price tag is going down, which means that really for the majority of Washingtonians, the amount they're paying into healthcare, the amount they have left over in their paycheck at the end of the month is higher. And the studies that Friedman ran found that really only incomes above $500,000 a year would see any negative impact on their total income.
That is astonishing how much money all of us could save and how much we could save as a state by switching over to Whole Washington's initiative for universal health care. And I remember from a presentation that Whole Washington did that I attended.
I'm sorry.
Okay.
Courtney wants to say something.
Oh, okay.
You can't see you're over there. I know you're blocked.
Thank you.
Go for it.
It's actually a question kind of based off of what Andre was saying, and a point that you were making specifically talked about the cost of healthcare, right? The reason why our country is spending so much money on the healthcare is that for-profit system, right? Is insurance companies, right? And unfortunately, I think a key issue in this understanding of universal healthcare is that people think that the prices that we are currently paying for our healthcare is what it actually costs, when in reality, the price tags that are on our healthcare currently are because of greed of insurance companies, right? You go to other countries that have universal healthcare and their prices are exponentially lower because there isn't that greed. There isn't that for-profit system. And so could you potentially expand a little bit on the idea of if we take out or perhaps, with Whole Washington, does it take out that kind of for-profit greed? Would the cost of our healthcare decrease because it would go back to what these products actually sell for, or would we see the same prices of the drugs, of the services under whole Washington?
I think the answer is yes and no. And part of it is because there is an incredible amount of sort of inertia in the system. And so while prices would go down, and I think especially over time would normalize at a price much lower than they currently are. And there are different ways, right? Some of this is just through efficiency, but also it would put the state in the position of more robustly regulating, more robustly controlling prices. So I think there's different ways to address the cost of healthcare. But I also think that it is, if we're just being thorough and honest about it, the United States has set down about a 100-year-long experiment of for-profit healthcare, and so we would not necessarily see prices reach the same as they are in other countries, at least not overnight. And I think that that's something that will take time, and particularly would happen at a much more rapid and robust rate if we could achieve something similar federally. Because Washington State has about, I think, 7.7 million people, somewhere in the 7 million range. And that is a large pool of people to remove from the profit incentive. It's a large pool of people to bargain prices with, but it's really nothing close to the scale of the United States. And the United States is a large country. There is a lot of money to go around, and the federal government is incredibly powerful. So a federal solution would be much more likely to be able to reduce prices to be competitive with what we see in other countries. But I do think that the Washington Health Trust and taking action here in Washington would be one of the most significant ways to address costs here in Washington and begin us down that pathway.
Andre, I have a follow-up question. I'm still astonished by how much money we could save with Whole Washington's initiative for universal health care. And I'm also thinking about what our provider shared with us earlier. I'm wondering, do you think that this move to universal health care in Washington would help attract more physicians, more providers to our state? I work with a lot of families, and I know that a lot of our Spokane families have trouble finding pediatric specialists, for example, and they've got to drive all the way to Seattle to get health care for their children. Do you anticipate more doctors wanting to come to Washington because of this initiative? Like, if this initiative were to get on the ballot and pass, what does that look like?
I think we would, and we can actually look at, even though it was back in the 40s, I believe, a lot of debate happened in Saskatchewan, the first province of Canada that passed single payer, and it was, there were people saying this is going to be a disaster, the whole healthcare system is going to collapse, and there was opposition, there was opposition from every direction, including providers, but the reality is that within a year, there were more doctors practicing in Saskatchewan, and they were making more money than before, and there were people getting much better health care much faster. I think we would likely see that in Washington as well. And Washington is a geographically diverse state. There are people spread across mountains and islands and rivers. And there are certain parts of this state that it is currently very difficult to practice in. And if you're talking about some of the more the less dense counties of Washington, the lower income counties of Washington, it can be very difficult to operate as a provider because there isn't as much money from the individuals there to pay into the healthcare system. But under the whole Washington system, the state is the one who reimburses, and so you can go into that part of Washington and know that you will be able to receive the same level of reimbursement that you're able to receive in Seattle. So in that sense, I think it will make it practical for way more providers to participate in different parts the state and make those practices economically viable. On the question of people moving into Washington, I think I don't know. It'd be very interesting to take some, do some polling on that, or some research on whether or not this would attract doctors specifically into the state. But one thing I will say is I think that it will, I think I saw a statistic today that said only 35% of Seattleites are actually native Seattleites. And a lot of people have moved into Seattle and Washington to chase various different economic booms. But I think one thing that universal health care would have a very profound effect on for the lifelong Washingtonian, which includes myself, by the way. I am a lifelong Washingtonian. But the retention, right? And I think that being born into a world of universal health care, right? And you're raised through our education system, and you live here with your family. Well, there may be good jobs in San Francisco or New York, and it's a big country with a lot of wonderful communities and places to live. But I think that it would create a very strong incentive for you to really set up your life here, to seek employment here, to start a family here, and just say, I've never worried about healthcare in my life. Why would I start today? I simply would prefer to not worry about my healthcare and set up my life here in Washington State, which has always been my home. And so I think that whether we're talking about doctors or entrepreneurs or even, service workers, even full-time parents, right? I think that it makes it so much safer to pursue the type of life that you're trying to pursue, to have that long-term vision and say, whatever happens, I know that I'm going to be able to get my prescriptions filled, right? I know that I'm not going to be saddled with unforeseen and tragic medical debt. So I think that when it comes to building a long-term healthy community in Washington, universal health care will be incredibly profound and have a huge impact on that.
I see that. I see how people will want to stay in Washington rather than, follow a job that might offer good benefits out of state. Why would they do that if their own home state, the wonderful state of Washington, if it has that safety net for people where they don't have to worry about being 36 hours away from being insured like Val shared, or these enormous deductibles, or a doctor sending your labs to a lab that's not covered. I mean, there's so much uncertainty and chaos in our system, and I think just by having that sense of that safety net, that security, that Washington's got your back, I think that'll do a lot to keep people here and to make this. I mean, I've been to every state, and I already think Washington's the best state in the country. It's true, but I think we could do so much better, and I'm so proud of the work that whole Washington is doing. Now, Andre, I know that we, the people, need to do something to help get this initiative on the ballot. Will you spell out exactly what all of us need to do to take this next step to get this initiative for universal health care onto the ballot?
Yes, absolutely. And, I think that there's an infinite number of answers to that question. So, to everyone out there tuning in today, thank you. You've got a great start here. And I think you have to start with yourself and your community. So tell a friend, tell your mom, bring it up in school or wherever it's appropriate. But I think that, everyone needs to recognize this for the crisis that it is and for the opportunity that it is. And to make that personal commitment to get involved, because one of the biggest things that we need is just more people. And this is a very, very people-centric movement and people-centric bill that we're pushing. But the reality is that it takes time and effort to build a movement. It doesn't just happen spontaneously. So it only happens when people decide that this is something that they're going to have a little chip on their shoulder about. So please start with that and get passionate about this issue. And to everyone out there who is young and healthy, which fortunately, at least on the second part of that statement, I am happy to say it still includes myself. Don't let that turn into inaction. Because like I said earlier, we all are going to have this this collision with the healthcare system. And so better to take action now while you are able and while you are not faced with the worst of it. Because when you are sick, when you are in a position where you wish that we had this, it will be because you are now not as capable and not as able to move this forward. So take action early, take action often, get involved, get passionate. Whole Washington is a statewide organization, and a lot of our organizing happens virtually, whether that's through Zoom, which I know we all can get a little burned out of Zoom, but that makes it so that everyone can participate no matter where you are, and even if you may have physical disabilities that challenge you from doing work that you normally think of as political organizing, you absolutely can have a huge contribution through our sort of digital ways of participating. So wholewashington.org, you can sign up to volunteer there. We have an events calendar. So there may be an event coming to your community soon. There are actually days of action happening across Washington on May 31st. So see if there's one coming in your area, and see if you can get out there into your community. And we have volunteer opportunities for people of all skills and all levels. And so even if you're just looking to dip your toes in, or you feel like you want to jump in with 2 feet and take on a major leadership role, these are all opportunities available to you. So get involved. Get involved in your community. So it can't all happen on the internet, and at some point, it has to be something that you see out on your daily jog, or it needs to be seen and heard everywhere. And so make sure that you don't just keep it to yourself. Don't just keep it on the internet. Actually bring it out to people in your life and in your community. The second part, and it's not my favorite part of politics these days, but fundraising is just incredibly important to our ability to succeed. Now, I don't want to discourage anyone, but if you look at the last 4 statewide ballot initiatives from the November election, whether you're talking about the yes campaign or the no campaign, they all ended up raising between $6 and about $25 million. So this is the politics of today. Winning on a statewide ballot is akin to winning a seat in the U.S. Senate or the governor's mansion. So this is big kid politics, and we actually think that we can get us on the ballot for a bit of a steal, maybe a couple $100,000, but that still is significantly more funds than we currently have available to us. So if you have funds that you can give to us, wholewashington.org/donate, that's part of it. If you have connections to people who do fundraising, the charitable, the sort of Washington's charitable donors, right? If you are able to help us make those connections, if you're able to host a small fundraiser or a big fundraiser, these are all things. We're actually currently still recruiting a fundraising coordinator. So if that sounds like you, you could have a huge impact on this. And fingers crossed, and please don't take this as any kind of guarantee, but we hope that we can have this passed by bill or by ballot by 2028, which is both a few years off, which gives us some time to plan and really build the infrastructure needed to succeed. But it's also coming up, and it is by no means guaranteed. So it really depends on the people of Washington coming together around this and making it happen. So don't feel like you have to, be rushed and that it's all go, 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 now. But also don't sit back, because those years are going to fly by. Every week, every month that we don't succeed at this, more people are just getting sick and suffering. So we are moving as fast as we can, but it is a gargantuan task. We are taking on one of the biggest, one of the most politically powerful, one of the deepest pocketed industries in the United States. And many charismatic politicians and true believers have walked this road before and come up short. And we mean to be the ones who succeed. And it takes a bit of, you have to really, really believe in order to say that now is the time, Washington is the place, and we are the ones who are going to change this. But if we don't believe that, then it is absolutely not going to happen. So please get involved. The question is not so much how, because there's a million different ways, but the first step is you must decide that you want to be a part of this.
Andre, thank you so much. We have just 3 minutes left. I heard that people can go to wholewashington.org. There's an event calendar that people can take a look at as a way to get involved. There's days of actions, volunteer opportunities. They can donate. They can host a fundraiser. And they can also sign up to pledge. Will you talk for just 10 seconds about pledging?
Yes, thank you so much for reminding me. So because we are not currently running a ballot initiative campaign, the next best thing that you can do is you can go to wholewashington.org/pledge. You can pledge to add your name so that when we do have the initiative, we can get in touch with you. We can get you a sheet. We can make it as easy as possible for you to sign. And so that's the easiest way to take action. And then the second easiest way to take action is just to post that on your Facebook, send it to your group chat. And so if you're looking to do something right now today, wholewashington.org/pledge is the easiest way to start, and you can take it from there.
I think Michael wants to jump in with something. What's going on, Michael?
Yeah, if I can just add a few things quickly. My name is Michael Doyle. I signed on with Whole Washington a few months ago to help organize locally, just to get the word out and try to help build a team like Andre was talking about, so we could build the groundwork for the ballot initiative that's coming up. So, if you want to get involved, please, like he said, go to wholewashington.org and to sign up to volunteer. That information will come to us, and we can get you plugged in. We actually have an event coming up for the May 31st National Day of Single Payer Action that Andre was talking about. So in Spokane, we're going to be having a free showing of the documentary Healing Us. The doors are going to open at 3 p.m. We're going to be at the Hive, and we should have a little bit of time for discussion after to talk about how to get more involved. So if you're interested, please do come out to that. Thank you.
Thank you, everybody.
Thanks for having me.
What else is there? We've got about a minute left. Does anybody have any closing thoughts or words?
I'm going to speak up real quick. I think this is definitely, we just went on from 2 shows. It shows, I think, from the perspective of the studio of what's important, and this is definitely part of the community. I'd like to propose maybe we can do this again, maybe 6 months or 4 months or whatever you think that would be important. Maybe we can time it up with some other events. But I think this studio would definitely like to back this up, this movement. And thank you, Katie, because this was well produced. You lined up all the people. I'm very impressed, and I think maybe we should try to get your own show.
Okay, you talked me into it.
Yeah, it was. Thank you for organizing this. It's the most people I've ever seen in this room. So I don't know how often KYRS hosts something like this, but
It's been a true pleasure to get to know everybody. We've had so many conversations over Facebook over the past couple of weeks, just bringing everybody together. This is such an important issue that affects everybody, and I am so thankful that whole Washington has started this, and I'm so thankful to be a part of it.
Well, that's our time this week in this creative mindset, free range mess around. Thanks to all of our guests for taking these 2 hours out of your day to explain these really complex and important issues to us, and to Katie for organizing the show again, essentially running it for us. Thanks for sharing this airtime, Robert. It's been good.
Thank you.
And here's our sign-off. Do you have questions about local government? Wondering who to complain to about an issue in your neighborhood? Wondering which agency governs certain things? Wondering why something is happening or how much it costs? Email us at freerange@kyrs.org with your questions, and we'll try and answer them next week. Free Range is a weekly news and public affairs program presented by Range Media and produced by Range Media and KYRS Community Radio, KYRS Medical Lake Spokane. Bye, everyone.
However, rather than focusing on the deep ethical and pragmatic questions that this techno-corporate displacement poses for real-life people, the developers of AI's brave new world are trying to divert social concern to the bots. A recent headline urgently asks, should AI systems have rights? And a leading maker of these systems is proclaiming that society must be concerned about, quote, the mental welfare of bots. Meanwhile, corporate owners are urging that their machine creatures be given a moral status to assure that they are ethically treated. Excuse me, but who are these greedmeisters to set ethical standards? The billionaires of tech have enriched themselves not by any genius, but by ruthlessly exploiting workers, carelessly polluting our environment, arrogantly violating our laws, stealing from their competitors and consumers, and bribing government officials. They are sleaze. This is Jim Hightower saying, besides, corporate bots need to go to the back of the line. Before we give rights to machines, let's secure the rights that moneyed elites have denied to women, the poor, nature, and democracy itself. The Hightower Radio Lowdown is made possible by you subscribers to Jim Hightower's Lowdown on Substack. Find us at jimhightower.substack.com.
You're listening to KYRS Medical Lake Spokane 88.1 and 92.3 FM.
KYRS Medical Lake and K222BG Dartford 88.1 FM, 92.3 FM, Thin Air Community Radio.
The following program was pre-recorded.
From New York, this is Democracy Now!
We believe the shooting was committed by a single suspect who is now in custody. The suspect chanted, "Free, free Palestine," while in custody.
2 staffers at the Israeli embassy in Washington, D.C. were shot dead last night outside the Capitol Jewish Museum by a man who shouted "Free Palestine" while being detained. We'll get response from the Israeli journalist Gidon Levy in Tel Aviv. Then to a doctor in Gaza as Israel kills another 51 Palestinians so far today.
So if Nasser is evacuated, we really are looking at the imminent death of hundreds of patients because we won't be able to take them anywhere. So it's probably all we're worrying about at the moment, and just praying and hoping that the IDF don't get any closer to us.
Plus, we look at how criticism of Israel is growing in Europe as the UK pauses trade talks with Israel and the EU reviews its relationship with the country. And we go to South Africa a day after South African President Cyril Ramaphosa meets with President Trump in the Oval Office, calmly rejecting Trump's false claims about a white genocide in South Africa.
I would say if there was Afrikaner farmer genocide, I can bet you these 3 gentlemen would not be here, including my Minister of Agriculture. He would not be with me.
President Ramaphosa also joked about not having a plane to give President Trump, referring to the $400 million luxury plane that the Pentagon has just accepted as a gift from Qatar for Trump. All that and more coming up. Welcome to Democracy Now!, democracynow.org, the War and Peace Report. I'm Amy Goodman. Israel's military has intensified its attacks on the Gaza Strip and its civilian population, killing at least 51 Palestinians since dawn. Thousands of Palestinian families have been forced to flee northern Gaza after Israel issued new forced evacuation orders for Beit Lahia and Jabalia. Gaza's health ministry reports Israel bombed 3 electric power generators and fuel storage tanks at the besieged Indonesian hospital. They've also surrounded Gaza's Al-Auda hospital.